Here we go. So the panel moderator is going to be Vinita Goyal, who's the impact manager for the Bay Area Health Inequities Initiative, or BARHA. Vinita, are you ready to go? I can advance the slides for you.
Yeah, thanks. Thanks, Kellen. Yeah, I'm actually the impact manager for climate resilience and environmental justice at BARHA. And just a little bit about BARHA is the coalition of Bay Area's 11 public health departments founded specifically to advance health equity. And in 2019, we joined hands with Rise Together, which is a coalition to end poverty in the Bay Area. And since then, we've added a community coalition to our efforts. So together we are a healthy equity, economic opportunity, and a racial justice implementation engine. Next slide. BARHA's specific mission is to transform public health practice for the purpose of eliminating health inequities using a variety of approaches that create healthy communities. And as a coalition of government agencies, we are uniquely aware of the essential importance of quality policy implementation to ensure that policy meets its intended equity outcomes. So we provide a range of services to help public health departments, allied agencies, and community-based organizations adopt and implement policies that can improve health equity. Next slide. And Michael referenced this perspective in his presentation, but I just like to take a minute to build on that. We know that place plays an important factor in health equity outcomes. One metric that informs our work in great deal is life expectancy. For instance, in the Bay Area, there exists decade-long differences in life expectancy by race, income, and neighborhood. Next slide. And this is the public health framework that Michael shared, but it illustrates both downstream and upstream activities for reducing health inequities, such as differences in life expectancy. It's more expensive for both quality of life and for the healthcare system, as Michael very skillfully explained, to be treating symptoms of the disease rather than the disease itself. Next slide. And so moving our funds upstream toward prevention is a better investment for our future and for the health of all people. And this is essentially where BARHA focuses our work. We are founded to address the living conditions and power imbalances that have created these differences in life expectancy and other health equity outcomes. That concludes the slides, and we can be all there for our panel discussion. Kellen, are we all ready for the panel discussion? Would we be all on the screen, or?
Yeah, so if all the panelists can start showing their video. I may need a little help with this, that I'm sharing my screen. If somebody can field some questions, that would help out.
Yeah, so it has been great to hear examples from the region and then at-scale strategies at the national level, ongoing research and policy levels to continue to advance the conversation. There were a lot of good questions and specific presentations. So the next 30 minutes or so, I'd like to ask some specific questions where we begin to see the big picture and really connect the dots between the presentations. I might bring in some questions from the audience as well. So really looking to have a discussion. The first question is for both Eric and Michael. Eric, based on your work in UCLA, and Michael, on your work in Contra Costa, you've been making connections between energy, equity, health, and even climate change. So I think I'd like to ask if you can share how we can bring these narratives into a mainstream conversation. Seems like these sometimes are limited to our circles that we are working in. What kind of activities have you engaged in so far to do so, to bring it to more mainstream conversation? And what are other possibilities that you might like to explore?
Michael, I guess I can take the first shot at that and speak to some of the work we've been doing. So another project that we're involved with that I didn't really talk about is something called the Advanced Energy Communities project, and we started out wow, almost 4 years ago, participating on a team to come up with a plan for a design for how like a low-income disadvantaged community could get to net zero energy. And a big part of that was sort of, addressing issues around the agency of people that live in these type of communities who are, tend to be renters predominantly and don't have the ability to, make decisions around deep EE retrofits of their homes, or to install rooftop solar or batteries or things like that. And I guess we did a lot of work as academics on that planning grant, and then we actually were successful in applying for a phase 2 of implementation funds. And so now we're kind of taking a backseat on a team that's going to try to build out this plan and go into a community and install a large community solar facility and work with the local community choice aggregation to develop a virtual net metering green tariff where renters can get access to the output of that solar system and finance EE retrofits in their homes. And so it's just really interesting, working with people that are doing outreach and trying to communicate these issues on the ground and get people excited about participating in this type of program, in the pilot program, and framing it not only in terms of like you can reduce your energy bill on a monthly basis, you can do something good for the environment, but you can also, improve your thermal comfort and improve the healthfulness of the indoor environment for the people that live in your home. And so, developing messaging around that, learning about people's sort of grasp of these issues, and also just building trust in these communities. Trying to demonstrate that this is not something we're trying to take advantage of anyone doing. We're trying to do this in their best interest. Has been a really interesting experience. But yeah, I think making it a much more comprehensive message where you're not just talking about energy, you're talking about health, you're talking about equity, you're talking about local workforce development, has been very interesting for us, and I think is the sort of new direction for how this work gets done. It's an integrated push.
So what I would say is that, rather than us having brought this to the mainstream, in some ways the mainstream is now coming to us. There's been a whole lot in the last year, nationally, but in the Bay Area especially, focus on equity and equity considerations. And I think it's now an opportunity to bring this message into sort of more mainstream planning. And I'll give you an example from Contra Costa, but it's an example that applies to every jurisdiction in the state. A couple of years ago, the state passed SB 1000, which is a requirement that when general plans get updated, they include environmental justice considerations. Our county is now going through a process of updating our general plan, which hasn't been updated, I think, since the 90s. It's very out of date. And there's an environmental justice part to it, which we're now developing. And so I think concepts like this can be put into general plans that are 20, 30-year horizon documents. And so it can really mainstream these concepts. The other thing that's happening in our county, and I don't know if it's happening in other counties, we just passed a climate emergency resolution by the Board of Supervisors, making the county take more immediate and affirmative action around climate change. And so I think some of the things we're trying to accomplish here, connecting health and energy efficiency as an equity measure can be highlighted now because the political body has moved towards recognizing these issues in a much more mainstream way. And so that's what I see as the opportunity is because of that heightened interest, we just make sure these things get institutionalized and are not just continue to be pilot projects on the fringe of what's going on.
Yeah, that's great. Seems like there are these institutional settings to take in, and then in Eric's case, kind of reaching out to where the community is and connecting them with their stories. Another question would be for Eric and Laurel from Community Action Marine. Seems like it's a very important piece of work that Community Action Marine is doing. Can you speak a little more about what resources will be available or are available to build capacity of institutions like yours in really building the infrastructure necessary to bring the implementation of these programs to scale? You know, you were talking about some of the ways where it is limiting to reach out to the community or for them to understand the benefits of such programs. So what kind of resources can be made possible to allow for expansion of your work and services?
We may have lost Laurel. Chris, are you still there?
I can move to the next question, and if they come back, we can repose the question to them.
Sure.
But moving on to then Brendan and your excellent work on the Green Healthy Homes Initiative. Seems like this is an at-scale strategy that exists where you've expanded throughout the nation. Can you, and you kind of hinted upon that, but I thought if you could go a little bit deeper and kind of talk about the challenges that you overcame to make this at-scale strategy possible. If you could narrow it to just a couple of key factors that you think were important in the process, that would be great. And then maybe connect that with the previous question that I was posing for the Community Action Marin is how are these resources made possible at the local level? If you can just touch upon those.
All right, great. Yeah, so I'll start off by saying, you know, it's kind of these kind of community development housing networks that we help to put in place as part of our client services work. It's different in every place. You know, I'll say for even when we were working in Marin County, I mean, one of our things that we're often trying to braid, right, and right now there's actually a housing urban development grant out there, but how to coordinate weatherization assistance programs, right, with lead hazard reduction programs. And that's one of the, you know, like a normal thing we'll go in, just because the GHHI Baltimore program, kind of our flagship office, like the original experience, and you know, I think, you know, you've most probably experienced this, or our audience must probably experience this, but you have different people in the community that would need weatherization services, that need lead hazard reduction services, that might need rehabilitation services, that might need, you know, energy efficiency education. And so what we've run into in you know, in Baltimore and all across the country is that when you're kind of first of all not allocating the resources as best as you could. You're duplicating efforts. So what we did in Baltimore was to get the people on the 7th floor and the 4th floor to just start working together. So now when you apply for any services in Baltimore, you can you're basically met with they call them basically like a housing specialist, and they kind of screen you for questions on the phone, and okay, this person needs weatherization, this person needs asthma services, they need and they'll basically direct them to these different programs that they, and so I think they have about 100, and that's program that's been around since 2009. And so they have about 120 partners in that. Same thing, when Marin County, was developing as a site. One of the things, like I said, lead hazard reduction. Lead's not a problem as much in Marin County. They have an older population, so they're actually more in need of kind of weatherization services, fall and prevention services, as you heard Laurel and I think Chris talking about. So I mean, we constantly learn lessons in the way that we work as kind of a backbone organization to help these networks develop. But they're really, when they make those compacts, they're kind of making it to fit, the goals should fit the community needs, right? So in Marin, it was a lot of the work there was connecting with health services, doing these kind of fall prevention, making that kind of part of your housing intervention strategy. So that's the kind of, I think, answer the first question, but circle back a little, how does this allow for the expansion of services? So some ways we operate, like I said, would be like kind of aligning and braiding. So just having agreements between partnerships, kind of like the model Michael was presenting. And some of this will get even more formal when you start sharing data, right? You'll have data use agreements and that sort of thing. But it's by that kind of coordinated activity and trying to actually integrate those interventions, specifically for the Contra Costa asthma pilot. Both the weatherization program and the energy efficiency programs share the same housing assessor and partner, Affordable Energy Association. So they're going to be kind of the point person for the housing coordination. So that's kind of the connection between the health services and the housing. But it's it's different in every state and even in regions how they're going to structure these solutions. But there's some general things and like aligning and these are kind of the things we work on the federal level, is trying to align like Department of Energy and Housing Urban Development. I mean, they have different income eligibility, right? There's also some of the, I think the great work we've done with the Contra Costa team was looking at, what in the energy efficiency world, I think they call them cliff dwellers. So those who don't qualify for those federal programs like weatherization assistance or lead hazard reduction, but still have those same kind of needs. They're renters and multifamilies. They might have housing issues, but they don't, kind of control their own destiny, and they don't qualify for these programs because of their income, but they're, don't also have enough income to do this kind of work or afford these investments themselves.
Yeah, thanks. It's really interesting. Yeah, every place is unique, and then the unique partnerships that exist there. Continuing with you, Brendan, and then if Michael can chime in as well. I think, Michael, you mentioned that funding is a challenge in the work as all of the funding that comes from the state level or from the federal level is connected with restrictions. And then thinking about the expansion of the work that you are doing, Brendan, at the national level, seems like there are private sector partners that are also playing a role. So I just wanted to explore and go a little bit deeper about the real role of the public sector in all of these interventions. There have been talk about different partnerships between the state and the nonprofit sector like MCE. What has been or can be the contributions from the private sector to really accelerate and amplify this work? Can you both or one of you start and the other follow?
I'm going to let Brendan talk more about this because he's been working on that at the national level. Our focus has been, our ultimate goal is to get Medi-Cal funding for this type of work. We haven't yet begun to explore private funding, but I'll let Brendan talk about it, and because he has much more experience on that.
Yeah, and Michael, I'll just point it to a couple of examples that I brought up briefly in the presentation. But like, for instance, some of the work, and they'll end up with different solutions. But working with I think it's the New Jersey Lead Fund, we basically did a statewide look at like what is the cost to to remediate lead service lines, lead-based paint, lead, potential like in the soil at certain kind of commercial areas in residential neighborhoods. So kind of got a full, what's the actual cost to solve this problem? And then how much do you, like how can you fund this? So in that case, right, what based on the research we did and looking really what you have to do to convince these policymakers, these decision makers, is show that there's a return on investment. Now, with lead funding, it's longer term, right? So I mean, there's so you have to kind of think, but it's generational impacts, right, that you're going to see, because these don't affect just one member in a family. It's usually not only did the parents get lead poison, but then the grandchildren get lead poison, and so you're really talking about like kind of a vicious cycle you're trying to start. And so it's so for the instance in New Jersey, what they decided was to try to get a bond passed to that would essentially help with funding remediation. It has both like kind of a grant program would be part of it, but also through kind of low or no cost loans to help incentivize building owners to especially of multifamilies to take these repairs upon themselves. So there's kind of that example. Another really interesting approach, like I said, was the NYSERDA program that we worked with, because here you had the energy sector kind of investing, right, in an asthma home, like to start off an asthma home visiting pilot. But so it's a little bit, when we started the project, we were really trying to attract healthcare visitors. But that's just for the pilot. It's the energy side. But in the pilot, it's designed that the managed care organizations are basically being put to connected with the housing, and in the end, what it's going to transition to is value-based purchasing contracts. So basically, kind of proving to the healthcare side that these housing interventions work, and then you've already kind of have in place that the managed care organizations, based on that, will be able to basically pay these housing providers back for that work. Mm-hmm. So that's one mechanism, and another one that we've we spent a lot of time working trying to implement was pay for success, and this is a model where rather than trying to convince you're trying to get people to invest upstream. So where are you going to come up with the the $10 million you need to do this, or the $100 million? And so one idea was to go to private investments, right, that want to kind of invest in these kind of social or environmental justice kind of investments, but they also want a return. Now, albeit maybe a less return, but they also solve that kind of problem of the upfront capital. And for instance, with a value-based purchasing contract, you could use that money to pay for the services up, and if the outcomes are met, right, the third-party private investors pay back get paid back for what they invested. If the outcomes aren't met, the investors lose their money, and the healthcare system has benefited because the participants have had the services, and it kind of takes away the disincentive of service providers taking on risk. So
yes,
and that one's actually been it's a little bit more complicated, so it has been harder to launch those type of projects.
Right. It seems like with more and more awareness and kind of the idea of corporate responsibility and thinking about more of the social outcomes, I think it could be a good avenue to explore. I wanted to bring Eric back into the conversation. And Eric, based on the work that you may have been doing with the CEC that you mentioned, and even other speakers, to the extent you can share, could you talk about the kinds of metrics that you are using in your work that is ensuring that racial equity is indeed at the center of all of this work? Wanted to request Eric to start. And
Sure. So I guess in the particular project that I described beforehand, that was up front and center in the form of a hard requirement for eligibility of participating in the funding, that the community be defined in terms of like people that lived within these disadvantaged census tracts whose sort of composite Kalman-Weierstrain scores were above the 75th percentile. Now, I guess you could have a conversation about to what extent is Kalman-Weierstrain sort of suitably capturing all of the dimensions of equity that you might be interested in. I think it's a pretty good tool, but certainly a better job could be done, and it could be refined going forward in the future. But it's kind of what we have now. You know, that I could say over the course of that grant, even from the initial RFP for the planning phase to the second phase where you're requesting sort of money for implementation, the requirements changed, right? So originally, if a person was going to be part of that program, they had to live within those disadvantaged tracts. But you could imagine building a community, like a larger scale solar generation facility somewhere outside, and doing the allocation across the boundary. As the grant evolved, it became clear that the solar facility had to be also located within those communities, right? And that's really important from like a workforce development standpoint, but also just the community, you know, taking ownership over the source of that generation and having it be embedded in the landscape. We've heard different things about that. You know, some folks on the ground have said, you know, maybe solar is an eyesore and looks like an industrial thing, and why should we be burdened by having more of that in our environment? We want to see more trees or more different things. So you learn a lot about different people's perspectives on the development of this type of infrastructure and sort of these type of projects, and their ideas may not necessarily match your own, but you got to be attuned to that. But yeah, that's an example of the metrics. I mean, other metrics that we're required to track in terms of the success of that project, you know, we'll actually be collecting consumption data. So our role on the actual phase 2 implementation is as sort of doing the EM and V. So we'll be collecting information about how much energy the participants in the program are consuming, and how much energy is being produced by any new generation assets that are built, and trying to ensure that you get to net zero to show that the model works if that's your objective. We'll also be evaluating, you know, on a fairly granular level, the performance of certain types of energy efficiency measures that will be implemented in participants' households. So, but yeah, that's, I guess, separate from the issue of the metrics that you're using. So for sort of ensuring that you're capturing the equity dimension. And for us, it's mostly Kalman-Weierstrain, I would say.
Others?
Well, you know, I would say for our project, you know, it's kind of de facto because the requirements from the state were that we focused our efforts on Medi-Cal patients. And if you look at the Medi-Cal population in Contra Costa, it tends to skew towards racial minorities or, you know, non-white. And so that, you know, so the assumption is it'll work out that way. But I think one of the things we'll be evaluating as we implement is, you know, who is signing up for this. You know, as mentioned in one of the other, I think Eric's, you know, presentation, the way you promote a program affects who's going to take advantage of it. And, you know, the way we're trying to promote our program primarily is we'll be contacting people soon after they've had a severe asthma episode, either gone into the hospital or had to go to the emergency room for asthma. Because we're partnered with the health plan, they can get that information almost real time. And you know, how we approach those people and who those people are will affect who ultimately signs up for the program. So we will have to look at that. You know, it's possible we could sign up, you know, 150 white families for the program, and then we, you know, would have to address that. I mean, they'd all be on Medi-Cal, they'd all be low income, but it wouldn't necessarily be racially equitable. A big part of what we're focusing on, and actually the manager in our health plan is giving a talk almost right now at a convening of the 22 entities that got the state grant about cultural humility and the need to be able to approach people in the right way. And so who we hire, I mean, we already have our public health nurse hired, but who we hire as our community health worker, we're going to want to make sure we get somebody who's, culturally appropriate. So, you have to be intentional about these things. Like Eric said, if you're not intentional about how you do your outreach and what you're doing, it's going to affect who you get in your program. And so we'll be monitoring that as we go along and hopefully making adjustments accordingly.
Mm-hmm. Yeah, and I think, Brendan, you already talked about the dimensions of equity in your work. So I know we are closing up, and just like to conclude the segment by asking or requesting you all to answer a lightning round of question as a theme these days in different symposiums. What looks promising about the field in the current moment? Just quick couple of sentences. Whoever wants to start can jump in.
Well, I'll go ahead and jump in here. I mean, I'll say it because as a public health professional, I think awareness is really, really important. So I think, there's an opportunity with COVID-19, in the pandemic, and just kind of the national awareness that, that race, depending on your race and the place that you live, this impacts, you're going to have different health outcomes, right? This is kind of in the public health community is very well known, but I think at this kind of moment, historical moment, it's at least on the Americans' kind of consciousness. So I think it's in that sense, we've been working on it for years. But I think there's going to be a lot more opportunities, kind of some of this CARES Act funding potential with new administration, new politics, that there could be. I don't know if we're going to go back to the kind of BARHA level of funding or anything like this, but I think we could see some more community development kind of funds, research. I think there needs to be a lot more research into these health equities, like some of the work we've begun and a lot of others are doing right now is important. But compared to other areas, it's been under researched, and a lot of it's tended to be around just kind of disparities and how to reduce disparities. But like and I think that's important, and you can monitor that by doing kind of population health approaches. But it's also kind of reducing those risks, which are kind of based on the underlying social determinants of health. It's kind of coming up with those measures, and some of those measures are policy leverage kind of influence measures. But those are, like what kind of partnerships do you have to do, is it across, these things are important, and I think there's going to be more of that kind of work in the future.
Thanks, Brendan. Michael,
I guess I would echo that. I mean, sometimes the only difference between a good and a bad idea is the moment where it's brought up, right? And I think for any number of reasons, we're in the appropriate moment for pursuing some of these things. I'm really encouraged by seeing sort of dedicated line item carve-outs and budgets for spending money directly in disadvantaged communities on certain types of things, and I think that's really great. I think some of the CEC work that we've been doing most recently wouldn't necessarily have gone to a project or program in the type of communities that we're working in now. So I think those are all positive developments.
Mm-hmm.
Yeah, I would just say what's promising is, there's just a lot of momentum that keeps building and building. When we started this work 10 years ago, the health field had to fight its way to the table around climate change discussions. And now it's just a much more accepted thing. And I think today's convening is evidence that people are trying to make those connections. And so I just think it's very promising that it's just getting discussed more and more. And like I said before, in the mainstream, you're seeing equity talked about everywhere at all levels.
Yeah, thanks for sharing. Yeah, I think this just kind of absorbing all that I learned today in these excellent presentations and just as part of this discussion, seems like this is the right moment for advancing these conversations, expanding work on policy, creating more innovative programs, and trying ways and partnerships to really bridge across with different programs across the nation. So thanks for your comments, and I'll hand it over to the organizers for the next part.
Great, thanks Anita. Thanks everybody on the panel.